Hello student, now we are going to discuss another applied aspect in respiratory system, that is high altitude physiology. So all of you know that whenever you ascend into high altitude, what happens? The barometric pressure reduces. So the first thing that you have to remember, that at high altitude, what happens? The barometric pressure, that is the total pressure, decreases, right? Okay. Second, you have to remember that the composition of the atmospheric air will not change irrespective of your altitude. So I am writing here that composition of the atmospheric air will remain same to same, right? Like for example, the oxygen percentage is the 21%. Even if you ascend into the Mount Everest also, the oxygen percentage will remain 21% only, right? Means if you collect 100 ml atmospheric air from Mount Everest also, then you will get 21 ml oxygen within that 100 ml air, right? That is the meaning of composition. And number 3, the partial pressure of the component gases, the partial pressure of all the component gases, not only oxygen, because the partial pressure is calculated based on this total pressure or the barometric pressure. So if the barometric pressure is decreasing, what will happen to the partial pressure? Partial pressure also decreases, right? So I have to remember that total pressure or the barometric pressure is decreasing. That's why partial pressure of the all gases, like for example oxygen, carbon dioxide, every will decrease, but the composition of the atmospheric air even in the high altitude will remain constant, right? Now with this concept, first thing we have to discuss that is there any rule that how this barometric pressure or the total pressure in the atmosphere decreases along with altitude? Answer is yes. The relationship between barometric pressure and the altitude, there is a linear relationship. So look at this graphical representation. Okay, so I am drawing one curve. So x-axis is the barometric pressure and y-axis is different altitude, right? Altitude, right? And x-axis is the barometric pressure, PB. So you'll find out almost a linear curve. First you look at the curve, right? So when the altitude is almost 0, right? Suppose this is 0. So that is at the sea level. So when the altitude is almost 0 or sea level, the pressure in the atmosphere is the 1 atmosphere pressure. So this is the normal barometric pressure. For every 5000 meter altitude, will reduce barometric pressure to 50% of the original. That means if I ascend to an altitude with a height of 5000, so okay, suppose this is the 5000 meter altitude. So from here, if I drop on perpendicular on this curve, from there if I drop a perpendicular on this x-axis, the barometric pressure will be half atmosphere. That means there is 50% reduction in the barometric pressure. Similarly, if I ascend to an altitude of 10,000 meter, right? So what will happen if you drop a perpendicular from here, and if you drop or extend that perpendicular on x-axis, you will find out that the barometric pressure at this altitude is 1/4 atmospheric pressure. So what are you finding out? You are finding out that there is almost a linear relationship. For every 5000 meter altitude, there is reduction of 50% of the barometric pressure. That's why for every 5000 meter, you are finding out that 1 atmospheric pressure has reduced to half atmospheric pressure, and again another 5000 meter means again there is drop of 50% of the atmospheric pressure, right? So please try to remember that for 5000 meter altitude height, there is decrease in 50% of the atmospheric pressure decrement. So this is the general rule. Okay, so with this rule, if you look at the total barometric pressure at the peak of Mount Everest, so you know that Mount Everest, okay, with a height of 8,849 meter. with this altitude, okay, so approximate 10,000 meter, so what will be the barometric pressure? Barometric pressure at the level of Mount Everest is approximately 253 millimeter of mercury. So look at normal barometric pressure at the level of sea is 760 millimeter of mercury. So if you look at the Mount Everest peak, the barometric pressure has reduced to only 253 millimeter of mercury. So with the help of this barometric pressure, if you calculate the partial pressure of oxygen, so what will happen to the partial pressure of oxygen at the level of Mount Everest? Your formula is 253 multiplied by 21 upon 100. That is the percentage. I told you that percentage or composition of the atmospheric air will remain same. So this will be equal to the partial pressure of oxygen at the level of atmosphere at Mount Everest. Similarly, if I ask you calculate the partial pressure of oxygen in the inspiratory air, that is PiO2, how will you calculate? You will calculate like this, that is the Pb barometric pressure minus pH2O, that is the water vapor pressure. We have discussed this formula in chapter of oxygen transport, right? So multiplied by 21 upon 100, this is the formula. Now remember here, Pb at Mount Everest is 253 millimeter of mercury. If you look at the water vapor pressure will remain constant because it depends on the body temperature. Whenever your core body temperature is fixed, then the water vapor pressure will remain same to same, that is 47 millimeter of mercury. So what you are finding out, that the water vapor pressure is not changing with altitude, because water vapor pressure you are taking inside the body. Until and unless your core body temperature is not dropping, the water vapor pressure will remain constant, right? So this way, if you follow this formula, it will be approximately 43 millimeter of mercury. Getting my point? Normally, partial pressure of inspiratory oxygen is generally 149 or approximate 150 millimeter of mercury. That has reduced to 43 millimeter of mercury at the level of Mount Everest. And similarly, if you calculate the alveolar partial pressure of oxygen at the level of Mount Everest, it will be approximately 40 millimeter of mercury. So there is severe reduction of the partial pressure of oxygen at the level of alveoli, which is 40 millimeter of mercury. Normally that is 100. So obviously this 40 millimeter of mercury means this will create severe hypoxia, and this kind of hypoxia where the partial pressure of oxygen in the arterial blood is reduced, we know that this is known as hypoxic hypoxia, right? So this is known as hypoxic hypoxia. That's why we say that the major problem in case of high altitude is the hypoxic hypoxia, right? So if I write down here that what are the different various problems at the level of high altitude, right? So problems at high altitude, right? Never forget this, very, very important, right? So number one or major problem that we have just discussed, that hypoxic hypoxia, right? Second is not only hypoxic hypoxia, in high altitude there is reduction in temperature. So hypothermia is the second problem. Hypothermia is the second problem. It is said that for every 150 meter altitude height, there is reduction of approximate 1 degree centigrade temperature. With this calculation, if you calculate the approximate temperature at Mount Everest, right? So Mount Everest has a temperature of minus 30 degree centigrade. So severe hypothermia may be created at the top of the Mount Everest. Okay, that is the second problem. Number 3 problem, very, very important for MCQ. Insensible water loss from the body. Insensible water loss from the body. You know, there are certain amount of water loss constantly going on from your body which you cannot perceive. Like for example, in your respiratory tract there is always evaporation of certain amount of water. Similarly, from your surface of the skin there is always evaporation of certain amount of water, and this evaporation increases if the weather is more dry in nature or if it is sweating, right? So that's why insensible water loss means, right, normally the insensible water loss amount is, you know how much? It is a 700 ml per day. Okay, within this 700 ml, it is said that from the surface of the skin, approximate 350 ml water is evaporated, and from the surface of the respiratory tract, another 350 ml of water is evaporated. So that is the insensible water loss, that is a normal. Whenever you ascend into high altitude, particularly the Mount Everest like altitude, there is calculated that 4 liter water is lost in the form of insensible water loss per day. So there is huge chances that huge amount of body water will be lost in the high altitude also. And not only that, point number 4, that is the fourth problem, is the solar radiation, right? Solar radiation is the number 4th problem. So now we can understand that not only the hypoxia, but also there are other problems at the level of high altitude, like for example we have discussed this, right? But in physiology, for particularly for the purpose of MCQ, we have to mainly concentrate on the first problem, that is the problem which arises due to hypoxia, right? So suppose I am ascending to an high altitude condition. Okay, what will happen? My body will try to adjust with this harsh environment in the high altitude. My body will try to cope up with this adverse environment. So all these adjustments that are going to happen in my body whenever I ascend to an high altitude condition, that is known as the acclimatization. That is known as the acclimatization, right? So what I am saying, all the changes, all the adjustment that is going to happen in my body when, or in the body of a person whenever he is ascending to a high altitude condition, that is known as acclimatization. Now acclimatization and adaptation, there is a little bit difference. Adaptation, generally we use this word when the person is residing in the high altitude for generations after generation, for long duration. So, the person who is residing in the high altitude, right, their body shape is different. The upper part of the body, particularly the thoracic muscles, are more well developed, right, and the lower part of the body is a little less developed. So this kind of adjustment, which is happening for long duration, okay, that is a part of the evolution of the organism. The tissue in the body will change at the level of chemical level as well as anatomical level, and there will be some changes which is part of the evolution, right? That is known as adaptation. So adaptation is basically a long-term phenomenon. But acclimatization means it is the short-term adjustment. Okay, suppose I am residing in the sea level and the normal altitude level, and suddenly I am going for some trekking in the high altitude condition. So then whatever adjustment is happening in my body in short term, that is known as acclimatization, right? So what will be the changes in case of acclimatization? How to remember that? So try to develop the concept. You will remember better in your examination. So suppose this is the representation of the lung, right? And this is the representation of our circulation, right? So this kind of diagram we have made earlier also. So you know the meaning of this. So this is the venous side, this is the arterial side, and this is the tissues. So the major problem that we are going to face at the level of high altitude is hypoxia. So how the body can increases the oxygenation at the level of tissue so that the tissue should not suffer from hypoxia. That is the ultimate target. So how can you increase the oxygen at the level of tissue whenever you are ascending into high altitude, and that will be part of your acclimatization. So first of all, you will try to increase your ventilation, means you will take more fresh oxygen into your blood and you will wash out more carbon dioxide from the blood. So that means there can be increase in ventilation. So there will be increase in ventilation, right? So patient or the subject will hyperventilate. Hyperventilate means whether there will be increase in tidal volume or rate of ventilation, there will be increase in both. Tidal volume will increase as well as there will be increase in respiratory rate. By this process, the person will increase his or her ventilation, right? Not only the ventilation, you have to increase the amount of gas transport at the level of blood, or I can say amount of diffusion you have to increase also. So the second acclimatization changes that you have to do, increase in diffusion of gases, increase in diffusion capacity of the lung. So how the diffusion capacity of the lung will be increased? Because you are doing hyperventilation, so more oxygen is entering in the lung. Not only oxygen, proportionally you have to increase the blood supply to the level of lung. So you are getting more oxygen at the level of alveoli. Proportionally, you have to increase the blood supply at the level of lung. So how to increase the blood supply at the level of lung? In case of high altitude, the cardiac output of the person increases. So more blood will flow at the level of lung, so that blood will take up oxygen easily. So this increased diffusion capacity can be increased up to 3 times than that of the normal. And how the diffusion capacity is increasing? By increasing the ventilation. So one way it is increasing the ventilation, and in second way it is also increasing the pulmonary blood flow. It is also increasing the pulmonary blood flow by increasing the cardiac output. So more gas diffusion is going to happen. Not only that, after the gas diffusion, the next thing that you have to do, the vehicle with which the oxygen is transported at the level of this arterial blood, of the venous blood, that vehicle, that you also have to increase, because then and then only you will be able to transport extra amount of oxygen. So the third point that I have to remember, that transport of oxygen at the level of arterial blood will be done by RBC. So you increase the number of RBC as well as you increase the number of hemoglobin, right? So how this RBC and hemoglobin is going to be increased? That under the condition of hypoxia, one hormone will be produced from kidney, that is the erythropoietin, and erythropoietin will stimulate the development of RBC as well as hemoglobin development. I will tell you how, right? Now, number 4. So apart from this hemoglobin increment or RBC increment, you also have to increase the number of capillaries at the level of tissue, that is known as the angiogenesis, new capillaries formation at the level of tissue. So if you increase the number of capillary density at the level of tissue, what will happen? Tissue will get more oxygen even if there is hypoxia. So number 4 is adjustment. Number 4th adjustment is increase capillaries, increase capillary density at the level of tissue, increase capillary density at the level of tissue. Now question is, how this increased capillary density can occur at the level of tissue? This is done by an important transcription factor, and that is known as HIF alpha. You must have heard this name. HIF stands for, H is hypoxic inducible factor. Hypoxia is inducing certain transcription factor, and that is known as hypoxic inducible factor. This hypoxic inducible factor alpha increases whenever there is hypoxia at the cellular level. And this alpha subunit will combine with beta subunit, and then it will start increasing the transcriptions of various genes, and those genes are responsible for angiogenesis. If I give an example of such gene, you will be able to understand. That is a V, that is vascular endothelium derived growth factor. Okay, vascular endothelium derived growth factor, VEGF, right? And you know that this VEGF is a factor which will be helpful for the development of the more and more angiogenesis or blood vessel formation at the level of tissue. So basic thing is that in presence of hypoxia at the level of cell, hypoxic inducible factor level, alpha level increases, and that alpha will bind with beta, and then it will start increasing the transcription of the genes, and various genes are responsible for this capillary genesis, right, or angiogenesis. Now, not only the capillary, even at the level of tissues, you know, the tissue has to be equipped in such a way that it can able to utilize or extract the oxygen. And we know the oxygen extracting organelle which is there at the level of tissue is mitochondria. So what will happen? You also changes certain parameter at the level of tissue, and that is nothing but you increase the number of mitochondria at the level of tissue, as well as you also increase the cytochrome oxidase enzyme at the level of tissue. Again, if I ask you how this mitochondria and cytochrome oxidase enzyme will be increased at the level of tissue, again it is done by HIF alpha transcription factor. So this way, all these 5 changes that I have written here, these are part of our acclimatization or short-term adjustment at the level of the body whenever one person is ascending to an high altitude. So this is a physiological phenomenon. Okay, whenever you are ascending to an high altitude, this acclimatization means it is a physiological phenomena which is going to happen in your body. But sometimes there will be disturbance in this acclimatization process, and the disease process will start in. We will discuss that thing. But before that, among all these different changes which is happening at the level of acclimatization, we have to understand a little bit more about this. Number one, that is increase in ventilation, as well as this increase in RBC and hemoglobin. So these two things we have to understand a little bit more, right? So how this ventilation is going to change at the level of high altitude, right? There is a sequence, so that we have to understand. So ventilation increases at the level of high altitude. How it is increasing, that we are going to discuss, right? So the main problem at the level of high altitude is nothing but hypoxic hypoxia, right? Hypoxic hypoxia. Now you tell me, hypoxic hypoxia means it will increases your ventilation by stimulating which chemoreceptor, central or peripheral or both? If this is the question, you all know that hypoxia means it is a stimulus for only and only peripheral chemoreceptor. So peripheral chemoreceptors will be stimulated in case of high altitude condition, right? Now whenever your peripheral chemoreceptors are stimulated, this will leads to increase in ventilation, so the person will start hyperventilating. So increase in ventilation will be seen, right? Now whenever there is increase in ventilation, you know what will happen? There will be wash out of more carbon dioxide from the body. So increase wash out of carbon dioxide from the body. If you increase more amount of carbon dioxide from the body, what kind of acid base problem going to happen in your body? There will be production of alkalosis. So this is nothing but development of respiratory alkalosis, right? So the primary problem is the hyperventilation, and that's why the alkalosis is occurring. That's why this is respiratory alkalosis. Now you tell me, this alkalosis is a stimulus for ventilation, or stimulus for peripheral chemoreceptor, or inhibitor for peripheral chemoreceptor? So we know that acidosis is a stimulus for increasing the ventilation, but whenever there is development of alkalosis, this alkalosis will try to decrease the ventilation through peripheral chemoreceptor inhibition. So whenever you are ascending to an high altitude, because of this hypoxic hypoxia, immediately there will be increase in ventilation. It is said that this increase in ventilation will start within minutes. So this increase in ventilation will be start within minutes, right? But after few hours, probably 2 to 3 hours, what will happen? There will be development of this alkalosis, and whenever the alkalosis is developed, it will inhibit the increased ventilation. So what will happen? There will be decrease in ventilation after few hours whenever you ascend to high altitude, and this inhibition is due to alkalosis which has been developed. This phenomenon, this condition is known as braking effect on respiration. This is known as braking effect on respiration. Someone is putting brake on ventilation, and that's why this is known as braking effect on ventilation, right? Now what will happen? This will not persist for long duration, because if your ventilation is suppressed in high altitude, then that will be decremental, because you have to increase the oxygenation. So what will happen? Okay, how the body will adjust? There is development of alkalosis, and this alkalosis is respiratory alkalosis. You know that whenever the primary problem is respiratory problem, in case of acid-base disbalance, the compensation will be done by kidney. When the primary problem is due to lung or respiratory problem, who will adjust, who will compensate? Kidney will compensate, metabolic compensation will happen. So this alkalosis means kidney will start compensation, okay? Kidney compensates in this condition. So how the kidney will compensate this alkalosis? Okay, very simple. Tell me, how can the kidney can compensate? So kidney will try to excrete more amount of bicarbonate. So increase bicarbonate excretion, and there will be increase H plus ion retention. By this way, kidney is compensating this alkalosis which has been developed. How much time this compensation will take? It will take few days, 2 to 3 days, right? So what is happening? Immediately the ventilation is rising. Later on the ventilation is decreasing within hours, and within days the kidney is excreting more and more bicarbonate. Kidney is retaining more and more H plus ion in the blood. So what will happen? This compensation, always this compensation is a overcorrection. So what I am saying, whenever the kidney is excreting bicarbonate, it will not correct exactly the 100%. There will be a little bit overcorrection. So whenever overcorrection is occurring, I can understand that the kidney is excreting more and more bicarbonate from the blood. Now whenever blood bicarbonate is excreted more and more, what will happen? The bicarbonate which is there at the level of CSF, this bicarbonate will be exchanged from the CSF to the level of blood. Getting my point what I am saying? So whenever kidney is compensating, it is excreting a little bit more or extra bicarbonate from the blood. And whenever this is happening, the CSF bicarbonate is coming out at the level of blood. So what will happen? The CSF is giving extra bicarbonate to blood, so there will be excess amount of H plus ion at the level of CSF, or I can understand that there will be development of mild acidosis at the level of CSF. So in high altitude, whenever kidney is compensating more and more, within 2 to 3 days the CSF will become acidic in nature. CSF will become acidic in nature. Now you all know that increase H plus ion at the level of CSF, this is a stimulus for which chemoreceptor? All of you know that if there is increase in H plus ion at the level of CSF, this is a very strong stimulus for central chemoreceptor. And whenever your central chemoreceptors are stimulated by this H plus ion, again there will be increase in ventilation, right? And this increase in ventilation is permanent. Permanent means until and unless you are correcting, okay, so this increase in ventilation is permanent. What do you mean by permanent? Means until and unless you are correcting the alkalosis, this ventilation will remain in this high value, right? So whenever you are correcting this alkalosis, then and then only this ventilation will return to normal. Otherwise this increase in ventilation is permanent. And sometimes it is asked that this increase in ventilation is how much percentage of normal. You remember that this is 1.65 times more than normal. That means 65% increment of ventilation is possible in high altitude after the compensation has developed by kidney, right? So if I explain this ventilation increment with the help of an graphical representation, so look how it looks like. So what we are going to discuss? We are going to discuss the changes in ventilation in high altitude, okay? And x-axis is the time, right? So suppose this arrowhead is the point when you have ascend to an high altitude condition, right? So we have just discussed that immediately whenever you are ascending to high altitude, your ventilation will start rising. So your ventilation will start rising like this. So this increase in ventilation will be seen within 2 to 3 minutes, within minutes. Then I told you that more and more increase in ventilation mean you are washing out the carbon dioxide from the body. Alkalosis will develop, and that alkalosis will produce a braking effect, and because of the braking effect, the ventilation will start decreasing, okay? And this will be decreasing within 2 to 3 hours. Now this decrease will continue for the next 2 to 3 days. By this 2 to 3 days, okay, within these 2 to 3 days, who is going to compensate? The kidney is going to compensate. And the kidney will do a overcorrection. Because of the overcorrection, H plus ion in the CSF will be high, and that H plus ion in the CSF will stimulate the central chemoreceptor, and once again the ventilation will start rising, and then it will remain high for long duration until and unless you are descending from the high altitude condition. So this is the condition which is seen in case of acclimatization, right? So now you can understand that acclimatization is a short-term adjustment. Within 2 to 3 days, whenever you are staying in the high altitude, within 2 to 3 days, your ventilation is rising 1.65 times than that of the normal, and this is nothing but acclimatized ventilatory condition in the body, which is 65% of the normal, more than 65% of normal, right? But if you stay in the high altitude for years after years, okay, right, suppose you are staying there for years after years, what will happen? Then the ventilation can decrease once again, right? And this decrease in ventilation is said that this is due to desensitization of the peripheral chemoreceptor. Desensitization of the peripheral chemoreceptor means after years, what will happen? The chemoreceptor will adjust this hypoxia and there will be decrease in sensitivity of the peripheral chemoreceptor. Then the ventilation can again decrease to the original or normal condition. But we have to remember that acclimatization means the ventilation can rise up to 65% of normal, that is 1.6 times of normal, right? So this way we have to remember that how this ventilation is changing at the level of high altitude, right? Now, second thing, if there is an alkalosis, tell me, alkalosis means which kind of shifting will occurs in oxygen hemoglobin dissociation curve. So alkalosis, the direct effect is the left shift of the oxygen hemoglobin OHDC curve, right? That is a direct effect. But this direct effect will not persist. Why? Because whenever this alkalosis is persisting for long duration, we know that alkalosis will increases the production of more and more 2,3-DPG, that is the 2,3-diphosphoglycerate, because we have seen the enzymes, right? The diphosphoglycerate or biphosphoglycerate mutage, that enzyme will be stimulated by alkalosis, and because of which there will be increase in 2,3-DPG. Whenever there is an increase in 2,3-DPG, what kind of shift will happen? There will be right shift of the oxygen hemoglobin dissociation curve, and this is the permanent shift. This is the permanent shift of the curve. So although immediately there will be left shifting of the curve, but this left shifting will not persist because this alkalosis, it will remain chronically in the body, and because of which it will produce more amount of 2,3-DPG, and that 2,3-DPG will causes final shift of the curve, and that final shift is the right shifting of the oxygen hemoglobin dissociation curve. And all of you know that this right shifting is advantageous. Why? Because this means there will be more increase in oxygen delivery, more unloading of oxygen at the level of tissue. So increase unloading of oxygen at the level of tissue. So this will be beneficial for the tissue also. The tissue will get more oxygen, right? So this is all about the ventilation that you have to remember. Okay, now I hope all of you get it, right? Very conceptual topic. Now next thing is that, so number one is the ventilation. Number two, the hypoxia stimulate the RBC development. How? So hypoxia is a stimulus for secretion of erythropoietin hormone from peritubular capillary cell of kidney. Peritubular capillary cell of kidney. This erythropoietin is a stimulus for colony forming unit of erythroblast. So this is the main target cell which is stimulated by erythropoietin. So erythropoietin is stimulated by peritubular capillary cells of kidney. That erythropoietin is mainly targeting this colony forming unit erythroblast. And whenever this colony forming unit erythroblast is stimulated, we all know that this will produce more and more number of RBC, and more number of hemoglobin will also develop within the RBC, right? So this will be obviously beneficial. Now if you want to remember the changes, then remember that whenever there is an hypoxia, within 2 to 3 hours erythropoietin production increases. Increased erythropoietin production is seen. But for the proper development of the RBC and hemoglobin, you require 4 to 5 days approximately, right? So whenever you ascend to a high altitude, within 5 days, your RBC synthesis, new RBC generation hemoglobin increment will be started, right? So this is the phenomena that you have to remember. Now next thing is that hypoxia is also a stimulus for, okay, vasomotor center of medulla. So this vasomotor center we have discussed in cardiovascular system. This is also known as the rostro-ventro-lateral medulla, right? This is the center which is connected with the sympathetic system. So hypoxia is a stimulus for this vasomotor center, means hypoxia is indirectly stimulating the sympathetic system, and that's why what will happen, the sympathetic system will stimulate the heart, so immediately there will be increase in heart rate. So this is immediately there will be increase in heart rate whenever you are ascending to the high altitude condition. Not only that, sympathetic system will also increase the cardiac output of the person, and it is said that cardiac output increment can be seen up to 30% of the normal, okay, more than 30% of the normal. And because the cardiac output is increasing, what will happen? The blood pressure of the person will also rise, and it is said that there will be moderate increase in blood pressure in case of high altitude when the person is developing acclimatization, right? So this is the scenario that you have to remember, the adjustment which is happening in the cardiovascular system. Now next one is that hypoxia, what is the effect on vasculature? Okay, we can see that the blood pressure is rising, the cardiac output is rising, the heart rate is rising. So what is effect on vasculature, right? So the effect of hypoxia on vasculature, we have to remember two things. In case of pulmonary vasculature, the effect is different, and in case of other systemic vasculature, the effect is different. So I'm writing here hypoxia, okay, at the level of pulmonary, okay, vasculature. What will happen in case of pulmonary vasculature? All of you know that hypoxia causes vasoconstriction, okay, vasoconstriction at the level of pulmonary vasculature. Although this vasoconstriction is not homogeneous, so whenever you expose to hypoxia in high altitude, what will happen? There will be pulmonary vasoconstriction, and that is known as hypoxic pulmonary vasoconstriction, HPV. But this hypoxic pulmonary vasoconstriction is not homogeneous, means all the part of the lung is not going to be vasoconstriction. There will be patchy vasoconstriction, right? So remember, this vasoconstriction will be patchy in nature, right? So some areas of the lung will get vasoconstriction and some areas will not get the vasoconstriction. That is the meaning of the patchy vasoconstriction. But if you look at the systemic vasculature, including your cerebral vasculature, so I'm writing here systemic vasculature. So what is the effect of hypoxia at the level of systemic vasculature, right? There will be vasodilatation. So systemic vasculature, including the cerebral vessels, there will be vasodilatation. So please remember, whenever there is an hypoxia at the level of high altitude, what will happen to the pulmonary vasculature? There will be vasoconstriction. What will happen to the systemic vasculature? There will be vasodilatation, including the cerebral vasculature. Now the question is, why these two vessels are behaving differently? Okay, so if you look at the molecular level, okay, so first you look at the pulmonary vasculature. So suppose this is the smooth muscles of the pulmonary vasculature. So what is this? This is the spindle shaped cell. So this is nothing but the smooth muscle cells of pulmonary vasculature. So the pulmonary vasculature smooth muscle, it contains a typical ion channel, which is nothing but oxygen sensitive potassium channel. This is very important. So this is oxygen sensitive potassium channel. This oxygen sensitive potassium channel we have also seen at the level of glomus cell. But if you look at the systemic vasculature smooth muscle, okay, so this is the smooth muscle of the systemic vasculature, right? So this is again a smooth muscle, right? Smooth muscle, where this is systemic circulation, right? And previously we have discussed this smooth muscle of pulmonary vasculature. So let's see, at the level of systemic vasculature, here the channel which is present, it is not oxygen sensitive potassium channel, but here it is ATP sensitive potassium channels are present in systemic vasculature, including the cerebral blood vessels. So what will happen now? You see the effect of hypoxia. So whenever there is hypoxia at the level of this pulmonary vasculature, right? So oxygen sensitive potassium channel, it normally remain open. Normally remain open means potassium is going out continuously through this channel. Okay, it's normally remain open in normoxic condition. Whenever there is an hypoxia, so obvious thing is that this hypoxia is going to causes closure of this channel. So this hypoxia is going to causes closure of this channel. Okay, so the channel will get closed. Whenever the channel is getting closed, the potassium will not be able to go out. So potassium will stay inside the cell. More potassium is staying inside the cell means more positive charge is staying inside the cell. So there will be depolarization of the cell, and that depolarization will open up a calcium channel. This calcium channel is known as voltage gated calcium channel, right? So this voltage gated calcium channel will open up. Whenever there is opening up of the voltage gated calcium channel, you can easily find out here that calcium is entering inside the smooth muscle, and whenever there is presence of calcium, what will happen? This smooth muscle will causes contraction. So there will be contraction of this smooth muscle, and contraction of the smooth muscles of the vasculature means this is nothing but vasoconstriction. So that's why we can understand that in case of pulmonary vasculature, there will be vasoconstriction because oxygen sensitive potassium channel will get closed, and that closure will leads to depolarization. Depolarization will open up voltage gated calcium channel, and that is causing constriction of the smooth muscle. But if you look at the ATP sensitive potassium channel at the level of systemic vasculature, its behavior is little different. What difference? Whenever ATP level is adequate, the channel will remain closed, right? So what I'm saying, so this is ATP level normal, the channel is closed, right? So the channel is closed. Whenever there is hypoxia, okay, so hypoxia means there will be decrease in ATP inside the cell. Whenever there is decrease in ATP, this will leads to opening up of the channel. The channel will open up. So decrease ATP means the channel is opening up. So whenever the channel is opening up, what will happen? It is a potassium channel which is open up. So potassium will go out of the cell. More potassium is going out of the cell means cell is losing positive charge. Cell losing positive charge means there will be negativity inside the cell. Negativity means I can say this is nothing but hyperpolarization. Hyperpolarization of the smooth muscle cell. Whenever there is hyperpolarization of the smooth muscle cell, can it produce action potential? Can it produce contraction? Answer is no. Hyperpolarization means there will be relaxation of the smooth muscle cell, and relaxation of the smooth muscles of vasculature means there will be vasodilatation. So this way, hypoxia has differential effect on different vasculature. Pulmonary vasculature is getting vasoconstricted, all other systemic vasculature is getting dilated. So this way, you have to remember the different behavior of this thing. So this way, we have understood all these changes which is happening in high altitude condition. So now we know this acclimatization phenomena. Okay, so how the ventilation is changing in my body, how the diffusion capacity is increasing in my body, how the RBC and hemoglobin is developed, how the capillary density is rising in the cell, okay, in the tissue, and how the mitochondria and cytochrome oxidase is increasing at the level of tissue. So now we know the reason of everything, that is the process of full acclimatization. Now I told you that in certain persons, this acclimatization may go in a wrong direction, and then certain diseases, some adverse effect will be created, will be produced at the level of high altitude, and that is known as basically the pathology of high altitude, right? So various pathology which can develop at high altitude. Okay, so I'm writing here diseases of the high altitude. Okay, diseases of high altitude, right? Various pathology. Okay, so three main diseases that you have to remember. Number 1, acute mountain sickness. Acute mountain sickness, right? AMS, right? Second, I'm writing high altitude cerebral edema. So HACE. So this is nothing but high altitude, right? Cerebral edema, right? Edema. So first you note down acute mountain sickness, that is AMS, acute mountain sickness, and this high altitude cerebral edema. This is the spectrum of a same disease. It is a spectrum, various spectrum, right? So if the disease is mild in nature, then it is acute mountain sickness, and if the disease is severe in nature, then it is nothing but HAC, high altitude cerebral edema. So this is basically same pathophysiology. If you look at, I will describe. So if you look at the pathophysiology is basically same. One is the milder version, that is AMS, and severe version is HACE. Apart from this AMS and HACE, the third one is known as HAPE. HAPE. This is nothing but high altitude pulmonary edema. Right? So this is HAPE, high altitude pulmonary edema, right? So this is a different kind of disease. From the name you can also guess, right? So now this is the three disease condition. This is the three disease condition that we have to read a little bit detail for our MCQ purpose. So first you look at acute mountain sickness, right? So acute mountain sickness, the diagnosis is purely clinical diagnosis. Okay, whenever you are ascending into high altitude condition, if certain symptoms develop within first 24 hour of altitude ascent, this is very important. So acute mountain sickness, it is developing within first 24 hour of high altitude ascent, and it is said that it will develop within first 8 hours. The first 8 hours is more crucial. The disease mainly develop within the first 8 hours. So if the certain symptoms are developing within first 24 hours of altitude ascent, then it will be categorized as acute mountain sickness. What are the symptoms? Number 1, there will be severe headache. Okay, there will be severe headache. Not only that, along with headache, there will be alteration of sleep pattern in the night, right? Not only that, there will be anorexia, okay, and there will be nausea also. So if these symptoms are developing within first 24 hour of altitude ascent, then it is known as the acute mountain sickness. So symptoms are mild, you can easily treat this condition, but along with these symptoms, if you are getting that the person is developing ataxia, okay, ataxia, that means problem in balance, okay, or posture, then ataxia. So if the person is developing ataxia along with these symptoms of acute mountain sickness, or the person is developing mental changes in high altitude within first 24 hours, then the person is suffering from HACE, high altitude cerebral edema, right? So headache, anorexia, nausea, vomiting, alteration of sleep, if it is happening, acute mountain sickness. If the person is developing a problem in balance, okay, and posture, that is the ataxia, along with that the person is also developing certain kind of mental changes, then the person is developing edema at the level of brain, and that is known as high altitude cerebral edema. So if I ask you, what is the common pathology in both of these conditions? So the common pathology in both of these conditions, right, that is the AMS, acute mountain sickness, and the severe form, that is HAC. The common pathology is development of edema at the level of brain. Now if I ask you which part of the brain where the edema is developing, your answer will be, it is nothing but corpus callosum. corpus callosum, particularly the splenium part or the posterior part of the corpus callosum. This is the area where the edema is developing. So basically edema is developing at the level of white matter of the brain, right? So white matter of the brain is getting edema, particularly the corpus callosum, the splenium of the corpus callosum, and that's why you are getting all this kind of problem. So why there will be development of edema in case of high altitude? Brain edema is developing in case of high altitude. Again, the same thing, the basic problem is hypoxia. So why the edema in case of hypoxia? So whenever there is hypoxia, what is the effect of hypoxia on cerebral vasculature? So there will be vasodilatation. There will be vasodilatation at the level of brain capillaries. So whenever there is vasodilatation, I told you that along with vasodilation, your cardiac output is also high. So brain capillaries is getting dilated and you are ejecting more cardiac output. So what will happen? There will be increased amount of blood flow, increased amount of blood volume at the level of brain. There will be increased amount of blood flow at the level of brain. Along with that, there will be auto-regulatory failure. There will be auto-regulatory failure. So we all know that brain has strong auto-regulatory mechanism. You cannot increase the blood flow to the level of brain just by doing vasodilation at the level of cerebral vasculature. There is an auto-regulatory system. In case of high altitude pathology, like for example AMS or HSC, there will be failure of the auto-regulatory system at the level of brain also, because of which there will be increase in blood volume at the level of capillaries of the brain. Now, whenever there is increase in blood volume at the level of capillary, what will happen? There will be increase in hydrostatic pressure of the capillary. And whenever there is increase in hydrostatic pressure of the capillary, we know that water will come out from the capillary and that will leads to development of edema formation. This kind of edema formation is known as vasogenic edema. So due to huge amount of hydrostatic pressure inside the capillary, the brain capillary is not able to hold the water because of the huge amount of hydrostatic pressure. So water is coming out of the capillary and that is leading to brain edema. So this is vasogenic edema which is developing in the brain in case of acute mountain sickness. So mild edema will be there, and high altitude cerebral edema, HSE, means there will be severe edema formation at the white matter of the brain, particularly corpus callosum. So what kind of treatment should be given if the person is developing this acute mountain sickness or this HSE? The treatment of choice for this condition is dexamethasone, right? Dexamethasone, right? So steroid is given, and or obviously, okay, dexamethasone plus oxygen supplement. Okay, oxygen supplement can be given in hyperbaric condition also. So hyperbaric oxygen or normal simple oxygen can be given. So oxygen you have to give, but the treatment of choice for this condition is dexamethasone along with an or oxygen therapy is given. Now you must be thinking that why you are not saying about acetazolamide. I'll tell you what is the acetazolamide role here. But this is the main treatment of choice, and additionally supportive treatment is also given, like for example for the headache you can give simple painkiller, okay, that way the treatment is given. Now this is all about the first two conditions, that is the acute mountain sickness and HSE. Now if you look at the HAP, look at the time period. High altitude pulmonary edema, this will develop generally within 2 to 4 days of altitude ascent, and particularly said that particular prone condition is the first 2 days of altitude ascent. The commonly developed condition, the HAP developed within first 2 days of the altitude ascent, but the timeline is 2 to 4 days. Within 2 to 4 days, if the person is developing severe cough, right, okay, dyspnea, okay, along with sputum, pink frothy sputum or white sputum maybe. So cough and dyspnea, severe cough along with dyspnea, maybe chest pain and sputum, whenever the person is developing after 2 to 4 days of altitude ascent, you are diagnosing a case of high altitude pulmonary edema. So what is the reason for this edema development in case of HIP, right? So we have seen that hypoxia causes vasoconstriction at the level of lung. So how this vasoconstriction is causing edema, that is the main thing. So if you look at the pathophysiology of the hip, so hypoxia is causing vasoconstriction, right? So that is known as HPV, hypoxic pulmonary vasoconstriction. Now if you look at the hypoxic pulmonary vasoconstriction, I told you that this is patchy in nature. What do you mean by patchy in nature? So suppose this is the pulmonary artery, it is giving rise to pulmonary capillary, okay, various pulmonary capillary I am drawing here. Suppose these are the multiple pulmonary capillaries. Patchy means if there is vasoconstriction of this capillary and this capillary, the other capillary will remain open. For obvious reason, the other capillary has to be open, because the heart is pumping more amount of cardiac output. It is going through this pulmonary artery. That capillary cannot prevent this high amount of cardiac output, right? So some of the capillary has to be remain open. That's why there is patchy vasoconstriction of some of the capillary and the remaining capillaries are open, and you are finding out that through the remaining capillary huge amount of cardiac output is flowing. Why? Because heart is pumping more and more blood, so more blood is reaching at the level of pulmonary capillary, and in that condition some of the pulmonary capillaries are closed. So what will happen? The remaining capillary will get more amount of blood flow. So this capillary will get huge amount of blood flow. This capillary will get huge amount of blood flow. Whenever the blood flow velocity increases through the capillary, okay, what will happen? There will be damage on the endothelium surface. What I am saying, this is known as the stress failure of the endothelium cells. So I am writing here, there will be damaged at the level of endothelial cell of pulmonary capillary. This is known as the stress failure of pulmonary capillaries. This is known as the stress failure of pulmonary capillaries. So whenever there is damage of endothelium cells of the capillary, you can easily understand that endothelium cell is removed because of the damage. So what will happen to the gap between two endothelium cells? The gap will be huge. That gap is known as the permeability of the capillary. So there will be huge increase in permeability. There will be huge increase in permeability of pulmonary capillaries, and whenever there is increase in pulmonary capillary, obviously the water will come out, okay? Not only water, the protein will also come out of this capillary. The RBC will also come out of this capillary. Certain WBCs will also come out of this capillary, and all these which are oozing out from this capillary will leads to development of edema formation. So you can understand that in case of high altitude pulmonary edema, the edema fluid is containing not only the water, it also contains huge amount of protein, huge amount of RBC, huge amount of WBC, and that's why I told you the patient may develop for this sputum, pink sputum, because this edema fluid is not only getting this water, it also getting protein, WBC, RBC. But if you look at the edema in case of high altitude cerebral edema, here the RBC, protein and cells will not be there, only and only water is coming out of this capillary, and that's why it was known as vasogenic edema. But in case of high altitude pulmonary edema, the edema fluid contain high amount of protein. Okay, so basically the nature is like that of the exudative type of fluid, right? So this way you have to remember that high altitude pulmonary edema pathology is different and high altitude cerebral edema pathology is different. So here there is vasoconstriction. So if you look at the pathology of this hypoxic pulmonary vasoconstriction, what I told, why there is vasoconstriction at the level of lung capillaries, lung arteries, why there is vasoconstriction? What is the pathology? I told you that oxygen sensitive potassium channel that will be closed, that will lead to opening up of which channel? Calcium channel, and that calcium is causing this constriction of the vessel. So by giving some drug, if you can block this calcium channel, what will happen? Then this patchy vasoconstriction is not going to happen, and then this other capillary which are open, they are not going to get this stress failure. So the treatment for this HAP, high altitude pulmonary edema, the drug that is given is calcium channel blocker. that is nifedipine. That's why the nifedipine is the drug which is used for high altitude pulmonary edema, but dexamethasone is the drug which is used for high altitude cerebral edema. But it is said that in case of HAPE, the treatment of choice is not the drug. Drug is not the first line. The first line is the oxygen, oxygen, oxygen. Oxygen is the most definitive form of treatment in case of high altitude pulmonary edema. But in case of high altitude cerebral edema, dexamethasone is the treatment of choice, first treatment of choice. In case of HAP, the first treatment of choice is oxygen, 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 and then you can give additionally nifedipine. Right. So this way you have to remember the various treatment. Now the last is that whenever this kind of pathology develop, whether it is acute mountain sickness, whether it is HSC, or whether it is HAPE, in all this condition, acetazolamide is given. Acetazolamide is given, right? Why? This will enhances the process of acclimatization, means this will enhances our body power to cope up with the adverse environment. So it will only facilitate the acclimatization process, nothing else. So this is not the treatment of choice of either in the hip or health, but it is always given because it will enhances the process of acclimatization. Then we also know that whenever the person develop any kind of this problem, there has to be descent from the high altitude, because in low altitude condition you will get more oxygen. So descent to a low altitude condition, descent to low altitude condition is also done for every diseases. Whenever the person is developing this kind of problem, it is done for every diseases. And oxygen, supplementary oxygen is also given, but supplementary oxygen is treatment of choice for this HAPE, and it is given in case of HACE also and acute mountain sickness also. So this is all about high altitude physiology and high altitude pathologies, right?